In this video, I'll walk through how to use the TreatGX software. We call TreatGX Medication Decision Support Software because the software identifies and helps to narrow down the list of potential medications that can be used to treat a condition. TreatGX is designed to help patients and their healthcare providers identify the safest and most effective medications for individualized treatment of a condition. The software does this by using important information about you, including genetic information from your TreatGX genetic test, your weight, height, past and present medications, and many more factors. To use the TreatGX software, you must have an account. You can access your account by clicking on the Canadian login from genexus.com homepage or by going directly to the login page. We suggest bookmarking it for easy access. If this is your first time logging in, you will be taken straight to the conditions page and then to the medications page. Otherwise, you will see this as your home page. On the left-hand side is a running feed of new features, TreatGX updates, and other important news. Clicking on a post will take you to the relevant page on the Genexus website. On the right-hand side is a list of navigation options. Let's start with entering your conditions. This is the current conditions page, where you can see a list of all conditions that currently exist in TreatGX, sorted by body systems. One by one, select all the conditions that you have, whether you take medications for them or not. In this example, I have selected high blood pressure, otherwise known as hypertension, type 2 diabetes, gastroesophageal reflux disease or heartburn, and depression. After you've selected all the relevant conditions, you'll need to click the blue Save button. Next, let's enter the medications that you have taken or are currently taking. You can navigate to the medications page by selecting the icon at the top of the page or by going back to the home page and selecting Current Medications. Medications should be entered under the condition they are being used for, if possible. If the condition is not yet included in TreatGX, the medication can be entered under Other. Simply start typing in the name of the medication, either the brand or generic name, and a drop-down list will appear. Just select the correct medication and strength, and it will appear in the medication list. You can find this information on the label of your medication. Once all your current medications are entered, you can also enter past medications that you have tried. This will help to get even more personalized medication options. Enter the medication in the same way, but select past and give the reason why it was stopped. Either not tolerated, not effective, or if it simply isn't needed anymore, select No Issues. Now let's start using TreatGX to get medication treatment options. Select the Options icon at the top right to take you to the Medication Options page. On the Medication Options page, you can see all the conditions that you've entered in your Current Conditions page. Select a condition to get started with generating medication options. In this example, I've selected gastroesophageal reflux disease or heartburn. When you first select a condition, you'll notice that some patient information sections are in blue text and some are in black text. The black text is pre-filled information we already know about you, such as your age or genetic test results. The blue fields contain information that is pre-selected as default or normative values to make it easier and faster to use TreatGX when you start out. If you are able to, update the blue information to be more personalized. In conditions where personalized information is needed to give safe and effective medication treatment options, some fields might be in red text. These fields must be completed before you generate medication options. To answer the questions, click the plus symbol in the blue sections to expand each section. Once a blue field has information changed in it, or once Create, Update, Personalized RX Options button is clicked, these fields then become black since these actions certify that the information being entered and used is correct. Once you have filled in or changed information, it is saved not only in that condition but also in other conditions that ask the same questions. If you use default information, remember to go back and update this later if needed, as some drugs may not be very safe or effective for you, but you will only know this if all information is entered accurately. Most conditions will ask for information such as kidney function and liver impairment, since these organs are vital for breaking down medications and can impact the safety of a medication. If you don't know your kidney function, you can use the default values, but remember, check later with your healthcare provider so you can get the best personalization possible. Other conditions might ask for weight, height, lab values, or genetics. Genetic results are automatically pre-filled and cannot be changed if you have also had the pharmacogenetic test through TreatGx done. Age is also unchangeable as it is generated from your birth date. Once all the required information is entered and you have updated all the blue information that you can, press the Create, Update, Personalized Rx Options button at the bottom. All information that is entered when this button is pressed is then saved as your information, so remember to update it later if necessary. TreatGx will use the information that you've entered, or the default information, to generate a list of dose-adjusted medication options for treating that condition. A list of medications will appear, along with instructional banners at the top with more guidance on treatment options. If you want to see more information about medications that are excluded or other options, select Other Therapy Options at the bottom of the page. In this case, you'll see that the medication called famotidine has been excluded because this patient has already tried it and it didn't work. Remember when we entered that in the medication list? I entered the brand name Pepcid Complete, which contains famotidine. If you do not want to see this information, Hide Other Therapy Options will hide it. The other feature you will see in most algorithms when you click Other Therapy Options is Next Line Therapy Options, the medications that are not preferred as first choice but could be considered later in therapy. This is an example from hypertension or high blood pressure, showing second-line medication options. That's all there is to it. Now you can use TreatGx too and get the right medication right from the start. Thanks for watching.